Hey y'all, what's going on? This is Jackie, and today I'm making a video about patients' death and hospitals' responsibility. So, state regulators issued an immediate jeopardy warning to Providence Sacred Heart Medical Center in Spokane, Washington, in late April after determining the facility failed to properly screen and supervise patients with dilations, according to records. So, on April 13th, a 12-year-old girl who had been a patient at the hospital since February died by. The girl has a history of self harm and had been assigned a sitter for around the clock monitoring, according to the Washington Department of Health records. Early April, the sitter was removed with no documentation explaining why. A camera that had been installed for remote monitoring to the patient's room had also been removed without a documented provider assessment or recommendation. On April 13th, the girl managed to leave her room on the pediatrics floor and later died. Investigators found delayed notification between when staff noticed she was missing and when security issued a missing child alert. They determined the girl was one of four patients with dilation at the hospital this year who did not receive twice daily assessments as required under the hospital's own policy. Failure to implement policies and procedures, monitor patients with suicidal ideation, and activate emergency responses without delays put patients at risk for physical and psychological harm, potential adverse outcomes, or death. State regulators said in an immediate jeopardy notice issued on April 30th. The immediate jeopardy was lifted one day later after Sacred Heart submitted a corrective action plan that involved retraining staff on existing policies and insurance compliance. The Department of Health said the investigation is ongoing. Following a tragic incident, Providence launched an internal investigation and self reported to health authorities, prompting an external investigation. A spokesperson for the Rutten, Washington based system said in a statement. Providence implemented improved protocols and trainings, which include screening all patients for potential risk and responding to situations where patients may go missing while hospitalized. At this time, we cannot share specifics due to patient privacy laws, other than to say that we are working in close partnership with all relevant health authorities to address the situation. Providence remains committed to working in close partnership with health authorities on this issue. So look, being a unit secretary, we know what Baker Acts are. It depends on where you live, what you call them. In Florida, they're called Baker Acts. I think in California, they're called 5150. And I don't know what they're called in other places. But anytime you have a patient who is a harm to themselves or other, they are usually in a hold. It's usually like 48 to 72 hours by a doctor. And they usually have a sitter because if they can harm themselves, we don't want you don't want them to harm themselves. So they usually have they're usually one on one. A sitter is in a room with them. Now we know that these hospitals be doing too much, okay? And people don't be doing what they supposed to be doing. We know this, so we ain't gonna sit here and play crazy, okay? I can tell you stories of sitters sleep in the room. Hell, even when you had inmates, we ain't even talk about that. With the inmates, and you have an inmate now. Of course, they're chained and everything, not chain, I don't use that word chain, they're handcuffed, but they will have the police officers in the room and they in there sleep, not the patient, the police officers. Okay. So we ain't gonna sit here and play crazy. We know what's going on. And for this hospital not to even follow their own protocol, I wonder what that was about. Like, I would really want to know, like, what. Oh, well, let me be nosy. You know what we about to do? We about to be nosy. Let me see. I might have to edit some stuff out so you can't see. But let's go. What's the name of this hospital? Because I'm nosy. So I did a little digging and I found this article. It talks about former staff at Spokane Youth Psychiatric Unit blame Providence foreclosure. So it just talked about a little boy who, he had some issues. And it says early last year, Providence Sacred Heart Medical Center in Spokane painted a bleak picture of what would happen without its psychiatric center for children and adolescents. So this was last year they were talking about this facility. It says, as children's mental health needs escalate, teens in the area will lose access to life-saving treatment, and another nearby facility will struggle to fill the gap. Sacred Heart executives wrote in an application for the State Department of Commerce grant in February 2024. If this unit downsized or closed, it would cause even less access in an under-resourced area, resulting in patients and families having to travel several hours for inpatient care. Sacred Heart asked the state for $1.8 million to pay for facility upgrades to make the unit safer and ensure that every child has access to high quality, affordable, and culturally competent mental health care. The pitch worked. The state awarded Sacred Heart the full amount requested. But Sacred Heart turned the grant down in April. In September, it closed the Psychiatric Center for Students and Adolescents anyway. Sacred Heart repeatedly reduced services and long-term resources in the unit, according to internal emails, public records, and interviews. Yet, as Sacred Heart cuts youth services in Spokane, the Providence system is pouring more than $1 billion into a hospital expansion in Seattle that sees fewer Medicaid patients, and its executives are making millions. If you're complaining that you're so broke, why are you able to pay these people so much? Said Dr. Corey Alexander, who resigned around the time of the closure. She joined nursing staff and former patients at protests last summer, decrying the closure and sounding the alarm about the diminishing option for teens in crisis. And let's see, current and former employees of Sacred Heart told Investigate West that they were hardly surprised when the hospital executives informed them that the center would close.
This summer, the facility has cared for children ages 12 to 17 diagnosed with depression, bipolar disorder, and other mental illnesses. In a statement, Providence says the move is meant to help them better increase their investment in outpatient care, and it comes as their nationwide shortage of psychiatrists. About 50 caregivers will be impacted by the move, and Providence says they're working to find other jobs within the hospital system.
Staff recounted the dwindling capacity of beds within the unit, declining morale, and rising concerns about safety. Some who remained there until the end said they felt overworked and unable to provide the quality of care that they wanted to due to the hospital's failure to hire and retain highly trained providers such as psychiatrists and nurse practitioners. Leadership promised new plans to plug the holes. So, yeah, so they had some issues. Susie Stacy, CEO of Sacred Heart, downplayed the role of finances in her decision to close the inpatient unit. She said she moved forward only after careful consideration of stakeholder feedback and grappling with staffing challenges that reduced the number of available beds over the years. We do not go into these decisions lightly at all. We have been struggling with physician recruitment for the last few years. This has been an ongoing struggle. So this issue that happened last month in April, that's why it happened. So it seems like they got rid of the psychiatric part and just put the kids wherever they were going. So the kids, instead of going to a psychiatric unit, they closed that and just put them on a regular pediatric unit, and the girl left and then ended up harming herself. So it looks like it's issues. And like I said, those of us that work in the healthcare field, this is nothing new. We know what this is because we see it. And like I said, I got stories, and I know y'all got stories. But hopefully this hospital get it together and they retrain the staff, because it seemed like nobody cared, and maybe somebody did care and they were speaking up, and we know how this go. So but hopefully they get themselves back on track and get everyone retrained on what they're supposed to do, and take it from there. All right, that's all I got for you. If you have any comments or questions, don't forget to put them below. Like the video, subscribe to the channel, and I'll talk to you later.